Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study that explores a new way to interpret a common veterinary diagnostic tool, the urine dipstick. As many of you know, the urine dipstick is a readily available and inexpensive method for the initial detection of various substances in a patient's urine, including protein. The presence of protein in the urine, a condition known as proteinuria, can be an important indicator of underlying kidney disease or other systemic issues in our canine and feline companions. In routine clinical practice, the urine dipstick is often the first step in identifying potential proteinuria. These dipsticks utilize colorimetric reagent pads that provide a rapid, semi-quantitative assessment of the protein present, primarily detecting albumin. Albumin is a major protein in the blood, and its presence in significant amounts in the urine suggests that the filtering units of the kidneys, called glomeruli, may not be functioning properly. Despite the convenience and low cost of urine dipsticks, their utility in accurately quantifying the amount of protein in the urine is limited. One of the primary reasons for this limitation is the influence of urine-specific gravity, often abbreviated as USG. Urine-specific gravity is a measure of the concentration of solutes in the urine, essentially indicating how dilute or concentrated the urine sample is. A highly concentrated urine sample can make even a small amount of protein appear more significant on a dipstick, potentially leading to a false positive result. Conversely, in very dilute urine, a clinically relevant amount of protein might be underestimated, leading to a false negative result. Factors such as the patient hydration status and kidney's ability to concentrate urine can significantly affect the urine-specific gravity. To address this challenge and potentially circumvent the need for a more involved test called the urine protein creatinine ratio, or UPCR, some researchers have proposed a calculated value known as the dipstick urine protein to USG ratio, or DUR. The urine protein creatinine ratio is a valuable tool because it has been shown to accurately reflect the total amount of protein lost in the urine over a 24-hour period. It involves measuring both the protein and creatinine concentrations in a single urine sample, and the ratio helps to correct for variations in urine concentration. However, performing UPCR can sometimes involve additional time, cost, and the potential need to collect further urine samples, which can be inconvenient for both the pet owner and the veterinary team. The concept behind the dipstick urine protein to USG ratio is to take into account the urine concentration when interpreting the dipstick result. By dividing the semi-quantitative protein reading from the dipstick by the urine-specific gravity, the hope is to obtain a more reliable indicator of true proteinuria that is less influenced by urine dilution or concentration. A previous study in human medicine explored a similar concept using a urine protein concentration to urine osmolality ratio to estimate protein loss. This ratio was then adapted for veterinary use, employing the urine dipstick protein to USG ratio, DUR, to estimate urinary protein content. In that earlier veterinary study, a cutoff value for detecting abnormal protein concentrations in urine was suggested as a DUR of 1.5 or greater, which corresponded to a dipstick reading of 1 plus proteinuria in urine with a specific gravity of 1.020, considered the upper limit of normal. However, at the time this current study was conducted, the actual performance and reliability of this dipstick urine protein to USG ratio had not been thoroughly evaluated in veterinary patients. Therefore, the researchers in this study set out with several important objectives. Firstly, they aimed to evaluate the correlation or the degree of relationship between the newly proposed DUR and the well-established urine protein creatinine ratio, UPCR, in both dogs and cats. Secondly, they sought to assess whether various characteristics of the urine itself, such as the presence of active sediment, indicating inflammation or infection, the presence of glucose, glucosuria, or the urine's acidity or alkalinity, pH, could influence this relationship between DUR and UPCR. Finally, the study aimed to evaluate the overall performance of the DUR in detecting proteinuria, particularly in relation to established guidelines like those from the International Renal Interest Society, or IRIS. The researchers also wanted to assess how the previously suggested DUR cutoff of 1.5 performed in identifying proteinuric samples in their cohort of animals. To achieve these goals, the researchers conducted a retrospective study. They reviewed the medical records of dogs and cats that had urinalysis, urine culture, and UPCR performed within a 24-hour period between 2016 and 2021 at the Lloyd Veterinary Medical Center of Iowa State University. Cases with incomplete medical records, or where the time between tests exceeded 24 hours, were excluded. The data collected included various patient details, urine collection method, physical and chemical properties of the urine, including dipstick results and specific gravity measured by refractometer, UPCR values, and sediment examination findings. All laboratory analyses were performed by the same veterinary diagnostic laboratory to ensure consistency. For the purpose of calculating the DUR, the semi-quantitative dipstick protein results were assigned numerical values based on the manufacturer's data. Trace protein was assigned 15 milligrams per deciliter, 1 plus was 30 milligrams per deciliter, 2 plus was 100 milligrams per deciliter, 3 plus was 300 milligrams per deciliter, and 4 plus was 2,000 milligrams per deciliter. The DUR was then calculated using the formula. Dipstick protein result in milligrams per deciliter divided by urine-specific gravity minus 1 multiplied by 1,000. For example, a urine sample with 30 milligrams per deciliter of protein and a specific gravity of 1.015 would have a DUR of 30 divided by 0.015 multiplied by 1,000, which equals 2. Statistical analysis was performed to assess the correlation between UPCR and DUR in both dogs and cats. They also examined how this correlation differed based on various urine characteristics. To evaluate the performance of the DUR in detecting proteinuria, the researchers used a method called receiver operating characteristic, or ROC, curve analysis. This allowed them to determine the sensitivity, the ability of the DUR to correctly identify animals with proteinuria, specificity, the ability of the DUR to correctly identify animals without proteinuria, positive predictive value, the probability that an animal with a positive DUR result truly has proteinuria, and negative predictive value, the probability that an animal with a negative DUR result truly does not have proteinuria, for different DUR cutoff values in relation to established UPCR thresholds for proteinuria in dogs and cats. Now, let's turn our attention to the results of this comprehensive study. The researchers included urine samples from a substantial number of animals, 308 dogs and 70 cats. They collected detailed information about these samples, including how the urine was obtained and various characteristics, such as the presence of glucose, active sediment, and the urine pH. When examining the canine urine samples, the study found a significant moderate positive correlation between the urine protein creatinine ratio, UPCR, and the dipstick urine specific gravity ratio, DUR. This indicates that, generally, as the DUR increased, the UPCR also tended to increase. Importantly, this correlation was not significantly influenced by the presence of an active sediment in the urine, the presence of glucose in the urine, or the urine pH. Interestingly, the correlation between UPCR and DUR did not differ significantly across most of the urine-specific gravity groups in dogs, except when comparing isosthenuric samples, urine with a specific gravity similar to blood, to more concentrated samples with a specific gravity greater than 1.030, where the correlation was weaker in the more concentrated samples. To assess how well the DUR could identify dogs with proteinuria, the researchers looked at different UPCR cutoff values. For detecting canine urine samples with a UPCR greater than 0.5, which is often considered a threshold for significant proteinuria in dogs, an optimal DUR cutoff of 1.4 was identified. This cutoff had a sensitivity of 89%, meaning it correctly identified 89% of dogs with a UPCR above 0.5. The specificity was 83%, indicating it correctly identified 83% of dogs with a UPCR below 0.5. The positive predictive value was high at 96%, meaning that if a dog had a DUR of 1.4 or higher, there was a 96% chance they truly had a UPCR greater than 0.5. However, the negative predictive value was lower at 63%, meaning that if a dog had a DUR below 1.4, there was only a 63% chance they actually had a UPCR below 0.5. The researchers also evaluated the performance of the previously suggested DUR cutoff of 1.5 in dogs. When this DUR was used to detect a UPCR greater than 0.2, the sensitivity was 82% and the specificity was 91%, with a high positive predictive value of 99%, but a low negative predictive value of 27%. For detecting a UPCR greater than 0.5 using a DUR of 1.5, the sensitivity was 89%, specificity was 83%, positive predictive value was 96%, and negative predictive value was 62%. When looking at a higher threshold of UPCR greater than 2, a DUR of 1.5 showed a high sensitivity of 98%, but a lower specificity of 45%, with a positive predictive value of 65% and a high negative predictive value of 96%. Turning to the feline urine samples, the study also found a significant moderate positive correlation between UPCR and DUR. Similar to the findings in dogs, this correlation was not significantly affected by the presence of an active sediment or glucose in the urine. No cats in this study had a urine-specific gravity below 1.008. The correlation between UPCR and DUR did not differ significantly across the different urine-specific gravity groups in cats. Urine pH also did not significantly impact the correlation in felines. For detecting feline urine samples with a UPCR greater than 0.4, a commonly used threshold for proteinuria in cats, an optimal DUR cutoff of 2.1 was identified. This cutoff had a sensitivity of 70%, a specificity of 100%, a positive predictive value of 100%, and a negative predictive value of 75%. This is a very high specificity and positive predictive value, indicating that a positive DUR result above 2.1 strongly suggests proteinuria in cats. The performance of the DUR cutoff of 1.5 was also assessed in cats. When used to detect a UPCR greater than 0.2, it had a sensitivity of 67%, a specificity of 90%, a positive predictive value of 97%, and a negative predictive value of 54%. For detecting a UPCR greater than 0.4, a DUR of 1.5 showed a sensitivity of 78%, a specificity of 82%, a positive predictive value of 83%, and a negative predictive value of 79%. When evaluating the detection of a UPCR greater than 2, a DUR of 1.5 had a very high sensitivity of 100%, but a lower specificity of 59%, with a positive predictive value of 39% and a very high negative predictive value of 100%. Now, let's delve into the discussion of these findings and their implications for veterinary practice. The researchers concluded that, given the very high positive predictive values observed for the optimal DUR cutoffs in both dogs, 1.4 for UPCR greater than 0.5, and cats, 2.1 for UPCR greater than 0.4. A positive DUR result is strongly suggestive of urinary protein loss at or above the borderline range. This suggests that the DUR could be a valuable tool in routine clinical settings to help determine when further, more quantitative testing using the urine protein creatinine ratio is indicated. However, the study also highlighted a crucial limitation of the DUR: its poor negative predictive value in most scenarios. This means that a low DUR result cannot reliably rule out the presence of clinically relevant proteinuria in either dogs or cats. Except for the detection of high levels of proteinuria, UPCR greater than 2.0, the negative predictive values were not high enough to confidently say that a patient with a low DUR does not have proteinuria. Therefore, the DUR should not be used as a standalone test to exclude proteinuric patients. The moderate correlation observed between DUR and UPCR is likely due to the inherent nature of urine dipstick interpretation. Dipsticks provide a semi-quantitative result based on colorimetric reactions that correspond to ranges of protein concentrations, rather than precise numerical values as obtained with UPCR. This reliance on color interpretation introduces a level of variability. Furthermore, while automated dipstick readers are more precise, many veterinary practices still use visual assessment, which can be influenced by factors such as improper technique and subjective color perception. Another factor that could affect the correlation is the difference in what the two methods primarily detect. Urine dipsticks mainly detect albumin, whereas the urine protein creatinine ratio measures total protein in the urine, which can include other proteins like globulins. In cases of lower urinary tract inflammation or bleeding, there might be a disproportionate increase in these other proteins, leading to a higher UPCR compared to the dipstick reading. However, the study found that the presence of active urine sediment did not significantly alter the correlation between DUR and UPCR in either species. The influence of urine's specific gravity on the correlation also yielded interesting results. In dogs, the correlation was weaker in highly concentrated urine samples compared to isostheneuric samples. This contrasts with some previous suggestions that interpreting dipstick results might be more accurate at higher urine-specific gravities. No such difference was observed in cats, although no cats in the study had very dilute urine. The study also investigated the impact of urine pH on the DUR-UPCR relationship, but no significant effect was found in either dogs or cats. While alkaline urine has been historically mentioned as a cause of false positive protein dipstick results, this study's findings, consistent with some recent research, do not strongly support this contention within the physiological pH range of urine. Similarly, the presence of glucose in the urine did not significantly affect the correlation between DUR and UPCR in this study. Although glucose can theoretically increase urine-specific gravity, the clinical relevance of this effect in most cases appears to be limited. The researchers acknowledged several limitations to their study, primarily stemming from its retrospective nature. While they ensured that urinalysis and UPCR were performed within 24 hours of each other, they could not guarantee that the tests were always performed on the exact same urine sample. They also did not review the medical histories for all potential factors that could influence dipstick results, such as the use of certain medications. Additionally, because the study required both urinalysis and UPCR to be performed, there was a smaller number of dipstick-negative samples included, which could potentially influence the assessment of the DUR's diagnostic performance in more dilute urine samples. However, the researchers suggest that the high sensitivity of urine dipsticks for protein detection likely limits the impact of this exclusion. In conclusion, this study provides valuable insights into the utility of the dipstick urine protein to urine-specific gravity ratio in veterinary patients. The findings suggest that the DUR can be a relatively reliable method for identifying dogs and cats with clinically relevant proteinuria due to its high positive predictive value. A positive DUR result should prompt further investigation with a urine protein creatinine ratio to quantify the degree of proteinuria. However, due to its variable and often poor negative predictive value, the DUR cannot be recommended for excluding proteinuria and cannot replace the UPCR for accurate quantification of urinary protein loss. The study contributes to our understanding of how to best utilize the readily available urine dipstick in the diagnostic workup of proteinuria in our veterinary patients. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and, as always, keep those minds inspired, hearts light, and tails wagging.